There's a new system called the PerioProtect system that is a customized tray system that is able to deliver an antibiotic or an antibacterial or any other medicament to the area around the gum line to treat periodontal disease and to maintain good periodontal health. And this system is very predictable, easy to use, and the results show that it really does help. And since periodontal disease is a very difficult disease to treat and maintain, I view this as being very patient-friendly and very effective.
I had issues with my gums bleeding for a long time, even though I took very good care of my teeth, brushed and flossed and did everything right. I still didn't have that under control.
Just every time I would brush my teeth, the sink would just be full of blood. It was uncomfortable. I probably had terrible breath.
I would bleed almost every time I brushed and or flossed.
The underlying cause of periodontal disease is biofilm. Biofilm is just a community of bacteria, of lots of different bacterial species in your mouth, and they gather together in one community and they cover themselves with a sticky, gooey substance. We call it a matrix, microbiologists do, but you can think of it as slime. It's hard to penetrate. The medication that your doctor's prescribing with the perio tray can get through the slime and get to the outer layers of the bacterial community. Now think about your biofilm like an onion. And it has many layers. Every time the tray is applied with the medication and holds that medication in place, you'll work against that outer layer. So peel off that outer layer of the onion. The next treatment, you're going to hit the regrowth, because bacteria are going to regrow as soon as you take the tray out of the mouth. You're going to hit the regrowth and the next layer of the onion. Peel that next layer off. Your goal is to whittle away that bacterial community so that it no longer prompts the localized inflammatory response.
This is the first system that I know of that really allows us to treat the cause of disease so you don't get the effects of the disease.
And I'm happy to say that since I started using PerioProtect, I haven't had any bleeding whatsoever.
I came back in, I guess a few weeks later, and the results were already just dramatic.
I noticed improvement almost immediately, and now, after having used the trays for many years, I have very, very healthy gums.
My teeth don't bleed when I brush them anymore.
The hygienist said, "Doctor, you have got to see these. You will not believe these readings."
Before I started with the perio gel, I had 7s, 8s, and 9 gaps all around my mouth. And now, even in my biggest former problem areas, 3 at the most.
I love my trays. When I put my trays on and I take them off, that filmy, gooky, sticky feeling on my teeth is no longer there.
Your teeth feel good. They're clean. They're bright. They're just fresh.
To get good results and to be positive about it, and getting good results motivates the patient to take personal responsibility, and this is not a difficult thing to use, so I'm very excited about it.